Hello again. This is Elizabeth Auchincloss, and this is episode 2 of the Psychoanalytic Model of the Mind. Last week we addressed questions such as, what is psychoanalysis? What is the mind? And what is a model? We also addressed some general questions about the psychoanalytic model of the mind and talked about where it fits in the biopsychosocial model. We pointed out that this will be a contemporary view of the psychoanalytic model of the mind, and that students of the mind no longer have to choose between the bio, psycho, or social aspects of the mind. We expect students to develop expertise according to their preferences and according to their training, but we also expect basic literacy across domains of approaches to the patient, hence this course. In other words, my view is that the mind-brain warfare which has plagued our field is over. You no longer have to choose. Now, we should get back to some more general comments about the psychoanalytic model of the mind. Let us ask the question, why do we need a model of the mind? Why is not a model of the brain enough? The most important reason is that studies have shown repeatedly that patients do not do well in treatment unless they are treated psychologically as a whole person. I could go on about this, but I won't. Intellectually, there is also an answer to this question. The intellectual answer can be found in the neighboring field of cognitive science or cognitive psychology, where in the last 20 years what has been called, quote, theory of mind, end quote, has come into fashion. Without going into all that is involved in theory of mind, which would be beyond my expertise anyway, let's just say two things about it. One, theory of mind is basically the view that other people and ourselves have a mind, that these minds determine what other people and we do, and that these minds might be different. 2. Cognitive scientists have shown, using various ingenious techniques, that children as young as 3 years old all use a theory of mind to understand what other people's intentions are. In other words, you are using a theory of mind anyway. Therefore, it's a moot point about why we need one. Unless you were raised in a closet or by wolves, which I think you were not, or have a serious brain disorder called autism, you use a theory of mind. So, your theory of mind should at least be a good one. As we have said in episode number 1, the psychoanalytic model of the mind is the most complex model of the mind ever invented for clinical purposes. So, you should understand it and use it. Next, we should ask the question, how was the psychoanalytic model of the mind invented? As we said, psychoanalysis is a word invented by Sigmund Freud in his work with his patients around 1895. Indeed, Freud invented the psychoanalytic model of the mind around 1900. As it is more than 100 years old, it has been worked on by many other people. Basically, a lot of ink has been spilt on this question of how the psychoanalytic model of the mind was invented, on who Freud was and what he thought, but I will try to be brief. How did he invent it? A little bit of history here. Sigmund Freud was a Viennese physician who started out his long career as a neuropathologist in a lab studying various aspects of the brain. He had a mentor who pointed out to him something which is true today. This mentor said, "You are young, there are a lot of financial pitfalls in a career in basic science research, and you have a family to support. In other words, you should go into private practice." Well, Freud listened to his mentor, and he did go into private practice. Most patients who were referred to him were suffering from what was then called conversion hysteria, so he began to treat these patients. At the same time, Freud was a very curious person, so he began to develop theories. Although these theories started out quite biological, as he was a neuropathologist, they gradually became more psychological. And psychology and psychiatry were evolving at this time, in some cases just being invented. And Freud believed strongly in the tenet of what is known as, quote, psychic determinism, end quote. Psychic determinism, derived from physical determinism, states that psychological events follow other psychological events in a lawful way, and those laws can be discovered. In other words, psychological determinism is the tenet that makes psychology a branch of the sciences. and not a branch of the humanities, of religion, or of mysticism. Freud also inherited from some French psychopathologists, including Charcot, whom many of you have heard of, the view that we still hold today that ideas may make you sick. These ideas are driven underground or are sequestered in the mind and then act as foreign bodies that can make you sick, for example, if you have conversion hysteria. So the problem was how to get to the sequestered idea and to integrate it with the rest of mind. Freud's practice was evolving. As he tried to treat his patients, he used the techniques of his time, which included hypnosis and other treatments. But he and his patients gradually invented the technique of free association, where the patient speaks freely about whatever comes to her mind, without censorship as much as possible. We still use this technique today. So when Freud and his patients invented the technique of free association, they created a new set of data. As I said, Freud had a curious mind. So he applied this idea of psychic determinism to his data, saying to himself, if ideas don't clearly lead to other ideas, the linking idea that explains the sequence must be unconscious. And unconscious was his word for sequestered. Now, there were many ideas at large at the time about why this sequestration happens, but Freud's ideas were unique and form the basis of the psychoanalytic model of the mind. Freud said that all the sequestered ideas are, quote, of the kind that would cause pain, end quote. So therefore, they are sequestered or unconscious because we don't want to know about them. In other words, these ideas are, quote, repressed, repression is his word, out of a motive of defense, his word again. In other words, these ideas are pushed into the unconscious because we don't want to know about them. An example would be, I can see that my father is a bad man. This idea is painful. It is sequestered in the mind, and it then comes back as conversion hysteria, let's say as conversion blindness. In other words, the idea that my father is a bad man causes pain, so it is repressed. However, this idea comes back in the form of conversion hysteria. The psychoanalytic repressed unconscious is a basic tenet of the psychoanalytic model of the mind. We will get back to this many times throughout the course. Next, we should ask the question, what does the brain have to say about the psychoanalytic model of the mind? Brain science definitely has a lot to say about the psychoanalytic model of the mind. First, it has a lot to say about the idea of an unconscious. When Freud started work in psychology, the idea of an unconscious was somewhat novel. This is not the case anymore. The cognitive unconscious is in fashion. This idea of a cognitive unconscious still mainly deals with unconscious ideas that we don't need to know about, like how to walk upstairs, rather than ideas that we don't want to know about. But the idea of the cognitive unconscious and a psychoanalytic repressed unconscious are getting closer and closer together. Furthermore, the trick is now to discover what is the role of consciousness in the equation. Lots of ideas have been put forward, but we trust this next generation can figure this out. 2. Mind and body. As we will see, the psychoanalytic model of the mind poses an idea that the mind is always connected to the body, which determines its characteristics. This idea is called, quote, the embodied mind, end quote. It is coming into fashion. For example, some people who have studied this idea are Lakoff and Johnson from the University of California, who say we cannot think at all without metaphor, and that metaphor is derived from the body. In other words, another popular view called the computational model of the mind is out. In other words, the mind does not function like a computer. 3. Self and other. We are in the early stages of a new biology in which human relationships are recognized as important regulators of both mind and brain beginning in infancy. There is much work in this area. Citing references would take me far afield. 4. The narrative self. The idea that the mind gives us access to a unified narrative or story that we need to tell us where we are in the world is made popular by neuroscientists and cognitive scientists alike. The psychoanalytic model of the mind allows us to study the narrative or stories that guide our behavior. Now a bit about how we will organize this course in the psychoanalytic model of the mind. This course will present 4 psychoanalytic models of the mind that are well known. 1, the topographic model, which includes the basic idea of a psychoanalytic repressed unconscious. 2, the structural model of the mind. 3, the object relations model of the mind. And 4, self-psychology. These models will be presented in the order that they were invented. In other words, this course is a bit historical. However, each model will also be presented in full. Each model will also be discussed according to what they contribute to 5 parameters, which are basic to every model of the mind. These parameters are 1, levels of awareness, which is called the topographic parameter. 2, the motivational parameter. In other words, what makes us tick? Why do we do what we do? And what do we want? 3, the structure or the shape of the mind. Remember that the ego, the id, and the superego, with which you are familiar, is only the most famous example of the structure of the mind. 4, development, which takes the point of view that everything in the mind has a history starting with birth. It illustrates the tenet that the child is the father to the man. And 5, the theory of psychopathology and treatment that is introduced in this model of the mind. A chart of terms with which you are familiar, such as the Oedipus complex, attachment theory, or separation individuation, will be shown, which will illustrate these 4 models and the 5 parameters. The student will see the chart grow as the course goes along. This course will end with a presentation of how best to integrate these 4 models of the mind. By the time you are done with the course, you will know a lot about the psychoanalytic model of the mind. By the way, throughout this course, I will use the words table and chart interchangeably. In other words, I might use either word. To summarize, in the clinical situation, the psychoanalytic model of the mind offers the clinician a good way to understand the patient and to understand interactions with the patient. It also allows clinicians a way to organize clinical details. This mode of organizing clinical details will allow the clinician to construct a representation of the patient's inner world so as to plan interventions and predict the future. Without such a model, a clinician would quickly become lost in a sea of experiential data. By contrast, a clinician equipped with a good model can get his bearings and chart a course for possible change. This ends episode number 2 of the psychoanalytic model of the mind. Stay tuned for episode 3, in which we will plunge into the topographic model of the mind, which was the first model of the mind that was ever proposed. For a review of what we have talked about, please see tables 1 and 2.